Hello, my name's Karen Harrison-Denning and I head up research and publications for a UK charity called Dementia UK. I've been a nurse for over 45 years now, but the majority of those years have been spent caring for families affected by dementia in a variety of contexts, care settings and services. More recently, and we're going back to 2008, I joined the charity and became a consultant Admiral Nurse. And it is today that I'm going to talk to you about Admiral Nursing. It's difficult to say where Admiral Nurses have most impact across the trajectory of dementia, because we evaluate every new service that we implement with Admiral Nursing, and we have a lot of data that shows the impact and outcomes to families across the whole journey of dementia. So we cannot say that Admiral Nurses work better in this part, for example, or that part, but I think that we work equally well across the whole trajectory. But I think what is important to say is that Admiral Nurses, their skills are best employed where there are the most complex of cases. So where we have issues of multimorbidity, where we have issues of behaviours expressed by the person with dementia that might challenge certain care settings or challenge their family members. It might be there are instances where it's difficult to engage the person with dementia to participate in interventions and activities, and we can help with some of those complexities. And I think that's where our direct face-to-face attention is best delivered, because that equates best value for money, if you like. But as I mentioned earlier, with our interactions with generalist practitioners, we can also generally influence better dementia care across the whole and social care economy. Admiral Nursing is a model that works with people with any type of dementia, any diagnosis of dementia. It's not specific for Alzheimer's disease, but what it does bring is specialist knowledge about all types of dementia. We've actually enhanced this further by developing specialist models within Admiral Nursing. So your average Admiral nurse has a caseload that includes late onset dementias, young onset dementias, vascular dementias, etc. But there are certain types of dementia that prove more challenging to health and social care systems. And an example of that, two examples actually, are Lewy body dementia and young onset dementia. It's disputed as to whether Lewy body dementia is one of the rarer dementias. There are some that would argue that it accounts for anywhere between 40–50% of dementias, but the experience of Lewy body dementia for the person diagnosed with the condition and their families can be very different experience to other types of dementias, simply by some of the signs, some of the symptoms, such as hallucinations and delusions and gait problems and sensitivity to medications, for example. And a lot of these people find themselves in generic services such as neurology or Parkinson's services, and then it emerges that they have a Lewy body dementia. And the management and advice associated with this type of dementia can confound generalist practitioners and may lead to the family having a very poor experience or experiencing unmanaged symptoms for so much longer. So we have developed specialist Admiral Nurses to work with these groups of people. And the same goes for young onset dementias, because some of these dementias are much rarer than the late onset dementias or Alzheimer's dementias, for example. And sometimes the advice and the support required can be of an intensity or a complexity that does require specialist knowledge. And we're finding a great deal of benefit to actually enabling some of our Admiral Nurses to specialise even further, so that they can actually work more specifically with rarer dementias, or for example, Lewy body dementia. We've experienced a lot of interest in the model of Admiral Nursing from other countries, Australia, Japan, the States. To the best of my knowledge, I don't think Admiral Nursing in its branded form exists elsewhere. There might be similar models, similar types of nursing, but Admiral Nursing itself is a UK-based phenomenon, model and intervention. That doesn't mean to say that it couldn't work in other countries. It would easily be adapted to other countries' sort of health, social care, and probably insurance schemes.